Virginia Risto. I'm a clinical nursing supervisor for ProHealth Home Care and Hospice. During college, I worked as a home health aide. So I discovered home care early on, and while I did work at the hospital after that, once I was an established nurse, I circled back to home care because that was truly my passion. In order to work as a nurse in home health, you need a 2 or a 4-year degree in nursing, as well as a solid foundation from the hospital setting. There are case managers and there are visit nurses, but they do very similar things. Case managers manage a caseload of patients, and they are responsible for not only physical hands-on care, but also to assess the plan of care, ensure the correct disciplines are seeing the patient, and assess goal progression. Visit nurses do all of those same things, however, they don't carry a caseload of patients, they report back to the case manager themselves. Home care nurses usually see approximately 6 patients a day. They see a wide variety of patients, from chronic disease management to wound vac therapy to IV therapy management. Home care clinicians have in the morning what's called a huddle, where we talk about their weighted count for the day, meaning how many patients they're seeing and the types of visits that they're seeing, as well as their caseload, how many they're case managing. They then call their patients, set up times, and then go out to see patients in the community. They always give patient time ranges as we're driving from home to home to home. So typically there is some unexpected delays that do come up, whether it's taking longer at one patient's house or traffic, weather, etc. They see the patient, do a physical hands-on assessment, as well as any cares that are needed, do documentation while they're in the home, and then go on to the next patient. Home healthcare nurses do have quite a bit of flexibility with their schedule. In the morning, they do need to call the patients between 8 and 10 a.m. to let them know when they are going to be seen. But after that, depending on how they set up their schedule, it is perfectly okay to go and see a couple patients, have their own personal appointment, and then go back to seeing patients. Challenges for home care nurses can include anything from patient living conditions to the weather as we're driving around to many of the different communities surrounding Waukesha. However, patients are usually extremely grateful, especially on those snowy days. There's nothing like a patient's gratitude and shock that you made it through the snow in order to see them. It is truly a rewarding part of the job, and patients are always happy to see the nurse whenever they come. I think when patients are in the hospital, oftentimes they put on a facade and they pretend like they are managing better than they really are. When a nurse and a patient are in their home together, there's no more facade. We can see exactly how the patient is doing because we see what food items are brought from the store and if they're truly complying with their low sodium diet. We see if they are managing their hygiene independently because we're seeing them several times a week, and we can see if they're able to change their clothes, if they've done the laundry in the laundry basket, And if needed, we can get therapy involved to help them really assess, do they need adaptive equipment, or do they need a social worker who can help them access community resources so they get more assistance. It really is a unique experience to be able to sit with patients and educate them one-on-one, to be able to do a full hands-on assessment as well as skills in the home, keeping the patient safe and truly allowing them to live their life to the fullest.